zoonotic viruses focuses on viruses that are transmitted by insects like mosquitoes, ticks, and sandflies. But we also investigate viruses that infect animals and can be transmitted to humans, the so-called zoonotic viruses. Most of the viruses that we study pose a big problem in developing countries. And these viruses attract little funding because they are not a problem in wealthier countries. Dengue, for instance, is a virus that is transmitted to humans by mosquitoes. And if these patients are not treated rapidly, if they do not receive fluid replacement therapy, they will die. Today, we don't have a way to prevent infection, to treat patients with severe disease, or even predict who will develop severe disease or not. Another virus that we investigate is chikungunya virus, also a virus transmitted by mosquitoes, the same mosquito that transmits dengue. Epidemics of chikungunya have a huge impact on affected countries. And you can imagine that countries, poor countries, have an even higher impact of chikungunya epidemics. We do not really understand why certain patients develop acute disease, why they resolve the infection, and why others do not. So just like with dengue, there is no way to prevent infection, there is no way to treat patients with chronic arthritis, chronic joint pain, and there is no way to predict who will develop chronic disease. We are working on developing a vaccine that can prevent infection, should be safe, effective, and affordable to those that need it most. But we also are looking into medicines that we can use to treat patients with chronic disease, those patients that suffer unbearable pain every day. And of course, we are also looking into understanding what is the reason that some patients develop severe disease, chronic disease, and by doing that, again, allow us to identify those patients that have a high risk to develop chronic disease. These are two examples of viruses that we are focusing on. Of course, we are working on more viruses like West Nile, Tick-borne encephalitis, Rabies, and others. And all the studies that we do are directed at understanding pathogenesis and development of better intervention strategies. These are all neglected viruses that receive little attention. And that's why it is important for us to focus on better ways to prevent these viruses and treat them if possible.